our ambitions would be that we would notice certainly a critical mass of individuals approaching change in the future in a different way.
My biggest role is around coordinating something new about the way long-term conditions are managed, where some of the stuff we've been hearing in the last couple of days is already starting to sound relevant and I have to say quite exciting. So yeah, my lead part there, somebody else is doing referrals, somebody else is doing a lot of work on prescribing. Rotham's already done a lot of work on that. But the big one, the black hole one that's not been tackled in any effective way is how do we start to tackle long-term conditions and how they are managed, especially in view of their resource use.
I think it's trying to embrace the new leaders that are coming through the system. We don't yet have clarity on what the what nationally will be dictated in terms of configuration of organisations, but we need to embrace those energetic and enthusiastic GPs who want to work with us to change the system. And regardless of all the debate about the health bill and everything, those people are already emerging and are already starting to change the way that we do things through joint working and joint sharing of ideas of what needs to be done.
One of the things that I felt about Barnsley Hospital when I first went there about 18 months ago was this is an organisation that has had things done to it. They're not part of it. And that's then reflected down at divisional level. And some of that is then they don't actually know how to react and behave. So it isn't that they don't want to, they just don't know how to. And I think the big thing for me is enabling them to know how to make the changes themselves rather than have them imposed on them, which is what's happened in the past.
Its luxury is that it gives me space for the strategic. I also quite like this models bit that we're having at the moment, because just occasionally somebody from a completely different background saying, you realise that actually this is different from this and requires a different approach, can be, what do they call it, one of those sort of aha moments. Oh, yes.
Being challenged myself personally, actually having to think very differently about how I work and the impact that I have, but also, I guess, the opportunity to work with others in this network to really make a difference in Yorkshire and Humber.
The real benefit for me out of this programme is actually interacting with a huge range of senior people across a huge range of organisations. So I've got some good ideas out of it. I've got some useful contacts of things that we want to consider. So whilst the organisation might not notice a direct tangible benefit, me maybe doing things slightly differently will start to filter into the organisation, and we might come up with some new ways of doing things.
I mean, it's created in my working environment, it's improved it at no end in terms of the sort of, I think, the well-being of the staff, the well-being of the patients, the environment that we're in, the relationships with the patients and the staff, the adverse incidents, all those different things that have improved, I think, because of the level of engagement and the relationships that are working, which I think, it's not all due to this, but it's got a very strong element of the sort of learning from this.
Oh, I think hope to take the techniques and the approaches and the thinking into some new areas and to continue to build on some areas within my own organisation that have been successful, but how we need to do things differently over the next 2 to 5 years. I mean, there's a massive challenge. There's a sort of philosophical and ethical challenge, I think, about how medicine and public health is pursued, and then I think that the driver will come from trying to do it differently within a shrinking financial envelope, to use the jargon, but I think we're going to have to be more effective with less. And I think some of these strategies and conversations hopefully will do that. That is what we have to do. And I think some of these approaches can be really helpful in how on earth to solve that problem.
The big part is that it's actually understanding what sort of problem it is you're dealing with. The project I set was quite big, and there's many different factors to it, so it might not be a standard solution to all of them. So I'm just trying to chunk some of it up and understand what it is we're dealing with at certain points in time will be one of the things I'll take away. There
was a lot of excitement, there was an energy, there was engagement from different groups across the system, inquiries, and actually we began to co-create something that looked completely different in terms of a possible service for the public, which is actually what we're about in this particular area.
Well, my project has been quite big because I had a new role, and my project was very much around bringing a big division together who'd been in a very bad place for a long time. And what this programme has really allowed me to do is think very differently about the tools and techniques that I will now use and have been using through the course of this programme to try and achieve what I set out to achieve. And I think it's been quite successful from some of the external feedback at work that I've received. It's completely changed the way that I look at things across the board. So even some of the things that you look at within your own family and how you deal with certain things in your own family. So particularly for me, the realisation that my role that I play at work is very much the balcony role. So that's been the really key thing that I latched onto, that stepping away, looking at the bigger picture, understanding who all the players are, how they're playing, and that's something that has completely changed the way I will practice forevermore now.